and let's get into it. So we're on question 11. You and your friends have a tradition where you set off hundreds of dollars of fireworks on the 4th of July. Since you're preparing for your RBT exam, you want to measure one aspect of the fireworks. You're most interested in the length of time it takes to set off one firework after the last one went off. What would be the most appropriate measurement to use to track this? So a piece of advice I always give to people preparing for the RBT exam is start applying what you're learning in real life. That's what behavior analysis is, right? We look at human behavior and all these terms, all these concepts that you're learning that you need to know. We apply them to everyday scenarios in order to change behavior. If you want to get really good at it, start doing that in your own life, okay? You'll be amazed how good you can be at this if you do that consistently. So in this scenario, you're popping fireworks and you want to measure something. What are you measuring, okay? Start there. You're measuring the length of time between one firework, okay, and the next one, right? So you know you're measuring some sort of time, right? Some sort of length of time. What can you immediately eliminate? Well, we can immediately eliminate frequency because we're not counting anything. And if we can eliminate frequency, we can eliminate rate because rate is just frequency with a time component. But we're not counting anything. You can eliminate A and B. That leaves us with IRT, into response time, and latency. So in both cases, IRT and latency, we're measuring the length of time between two things. Latency is the time between the SD and a response. IRT is the time between two responses. Are we measuring from the beginning to the first response or between two responses? Well, we're measuring firework 1 to firework 2, and then firework 2 to firework 3, firework 3 to firework 4. Okay, therefore we are measuring what? Well, the inter-response time between fireworks. Okay, we want to know how long does it take from 1 to 2, 2 to 3, 3 to 4, 4 to 5, etc. Okay, most appropriate measurement to use this, to measure this, is IRT. Okay, very basic measurement question, something you should be able to answer very quickly, very easily. If you can't, go back to the basics, get fluent in these basic measurement concepts, okay, and come back and redo this question. Very basic measurement question. 12. Jen's husband golfs every Sunday morning with his buddies. Whenever he comes home, he leaves his muddy shoes in the middle of the floor and Jen scolds him. Jen decides she will now give verbal attention to her husband when he puts his shoes in the closet and will ignore him when he puts his shoes in the middle of the floor. What procedure is she using? All right, so if you're getting good at this, something should immediately jump out to you. What is that? Differential reinforcement, right? Jen is now providing attention, okay, to the behavior she wants to see and putting the behavior she doesn't want to see on extinction. Classic differential reinforcement. If we look at our answer choices, that's what they're asking. What differential reinforcement procedure is she using? Okay, well, since she wants to eliminate this behavior, she's not using a DRL. The next question you need to ask yourself is she reinforcing in the absence of a behavior? Okay, or is she actually reinforcing for a separate behavior? Okay, well, DRO is when you reinforce just when something's not happening, right? But in this case, there's two behaviors, and Jen is trying to teach a replacement behavior. So DRO is out. Remember, DRO doesn't teach replacements. So we have DRA and DRI. So the question you ask yourself is the behavior with teaching versus the one we're putting on extinction, are those incompatible or can they happen at the same time? If they're incompatible, it's DRI. If they are compatible, if they can happen at the same time, it's a DRA. Can Jen's husband put his muddy shoes in the middle of the floor and in the closet at the same time? No, those are incompatible behaviors. Therefore, this is differential reinforcement of incompatible behaviors. Jen reinforces putting shoes in closet, extinction, middle of the floor. Those behaviors can't happen at the same time. DRI. Differential reinforcement is challenging. It's hard to learn. Once you do learn it, okay, it makes sense. It's very easy, right? If you're just starting to study, you might want to look at differential reinforcement after you've learned some of the other concepts, okay? It's one of the more difficult things to grasp. If you got this question right, very good. 13, RBTs have several roles in service delivery. Which of the following is not the role of an RBT? So the exam, they will test you and they want to know that you know your role as an RBT, okay? They really want to stress the importance of you knowing what your job is, okay, and what you're meant to do. This question is asking us which of the following is not the role of an RBT. When we have a not question, 3 of the answer choices will be correct and 1 will be wrong. So we're looking for, because we're looking for, right, the not, right? So 3 of these will be the role of an RBT and 1 will not. So let's find the answer choices that are the role of an RBT. A, implement behavior plans. Absolutely. Implementation is the main role of an RBT, okay? That is certainly a role of the RBT. B, conduct indirect assessments. Sure, you might conduct interviews, you might discuss things with parents. You absolutely can conduct indirect assessments if asked, okay? So that is part of your role. C, assist with parent training. Definitely, okay? Assisting the BCBA and what they're doing is a very important part of your role as an RBT, okay? When your BCBAs and supervisors start to trust you, you may be asked to assist even more, okay? You want to be helpful because remember, everything we do is for the client, right? And the more we can help each other, the better the success of the client. D, design reinforcement systems. This one is not a role of an RBT. It is not your job to design reinforcement systems. It is not your job to write treatment plans, all right? You might assist in these things, but if you're ever asked, hey, design a reinforcement system, that is not your role, okay? You implement reinforcement systems. You might give feedback to your supervisors, okay, on them. You might assist in these things, but to ask you to simply design a reinforcement system is outside your scope. That is not within your role. Again, A, implementing behavior plans is the primary role of the RBT. That is your main job. 14, Ben is asked to assist his BCBA with a new client assessment. The 2 arrive at the client's house and start to set up. As they are setting up, the BCBA is asking the client, what's your name? What's 2 + 2? Can you spell dog? Etc. What most likely explains what your BCBA is doing. All right, this should be an easy question, okay? There are some questions on the exam that are going to be very easy. In those cases, you need to be able to answer them quickly. The quicker you can get the easy ones right, the more time you have on the difficult ones. There's one word that should just come to mind when you're reading this question, okay? If you've been studying the task list study guide and reviewing your flashcards and doing some questions, there's one word that comes to mind when you see a BCBA or an RBT asking the client a lot of different skills, okay? That's all the BCBA is doing is asking the client questions to see what can they do, what can't they do, what's their skill level. And when we're doing that, what do we call that? We call it probing, shaping, reinforcing, or communication training. Well, it's very clearly probing, okay? The BCBA is coming in and very casually probing for skills that the client can and can't do, okay? We're not delivering feedback. We're not teaching anything. We're just figuring out some baselines. Where are they at? What are they doing? As an RBT, you should be probing all the time. Kids change, clients change, even adults, develop and change. So we want to make sure our knowledge of what our clients can and can't do remain up to date. How do we do that? By probing. You're simply seeing, can you do a skill or can you not? 15, yesterday you were reviewing session notes from the past week. You start to notice that you and the other RBT on the team are running many of the skill acquisition programs differently. What is the most appropriate action to take in this scenario? So it's not uncommon for you to work as a team on one client, okay? Sometimes you'll have 2, 3, even 4 RBTs on the same team. In this case, it's very easy for treatments, okay, to start to drift and differ because there's a lot of hands in the pot, a lot of things going on, okay? So in this scenario, you were savvy enough to catch this. You notice something's a little off. You think somebody's running something incorrectly or different than you. So what do you do in this situation? Do you A, call your BCBA and report the other RBT on the team for incorrectly running programs? Well, A is not bad if you just say call your BCBA, but if you're reporting the other RBT for incorrectly running programs, you don't know that because all they're doing is running them differently than you are. So how do you know that you're not the one running it incorrectly? Okay. And you really shouldn't be throwing your team under the bus, you should be trying to develop a strong sense of team. Again, we're working for the clients. The more teamwork we have, the better. So A is wrong. It's too strong. B, ask your client's parents how the other RBT does things. Compare that to what you do. No, I mean, you really shouldn't be talking to the client's parents about RBTs and how they're doing things, etc. Okay. You're kind of encroaching on that personal professional boundary, okay, because that's your team member, right? And the client's parents, they're not going to get the full picture of what the RBT should and shouldn't be doing. And again, you don't know if what you're doing is correct or not. You just know it's different. B is out. C, ignore it because it was only 1 week of data and notes. Absolutely not, right? On the task list, there's many items about communication. That's because when we notice something, we say something in a timely manner, okay? Ignoring it doesn't make it go away. It doesn't solve the issue. That leaves us with D. Tell your BCBA and ask for clarification for yourself and the other RBT. Absolutely. Simply reach out to your BCBA. Hey, I noticed we're doing things differently. How should they be done? Can we clarify? This way, okay? You're making sure you're doing it right. The other RBT is doing it right. You're not blaming anyone. You're communicating. You're doing everything exactly how you should be doing in this scenario. The answer here is D. Okay, 16. What measurement system in applied behavior analysis captures every instance that a behavior occurs? All right, again, a very easy, straightforward question. This question should take you 15 seconds, 20 seconds at most. It's almost a definition question, okay? There's gonna be some super easy questions on the exam. Get them right, get them quick. What measurement system in applied behavior analysis captures every instance that a behavior occurs? Is it continuous measurement, discontinuous measurement, interval recording, or permanent product? Well, the only measurement out of these choices where we are recording every single instance of a behavior occurring is, of course, continuous measurement. The other measurements, okay, are all isolated, okay? They're intervaled out or they're discontinuous, right? Or we're only measuring one instance, or sometimes we don't get a measurement. The only one where we're capturing every instance of a behavior is continuous measurement. 17. Functional communication training is commonly used in ABA to teach clients how to communicate with those around them. During FCT, you will reinforce successive approximations of desired communication. What is this called? Okay, kind of a tricky, wordy question, okay? Talking about functional communication. They have this successive approximation, right? What is this called? This is simply a definition question disguised as a scenario question, okay? What they're asking you is, what is it called when we reinforce successive approximations of desired communication? Said another way, reinforcing successive approximations of desired behavior is what? Okay, is that probing? Well, we know it's not probing, okay, because in probing, we're not reinforcing. We're just seeing if we can do something. Is it task analysis? Well, it's not task analysis, because the task analysis, we're breaking down complex behaviors into steps, okay, which we're not doing in this situation. Is it shaping? Yes, absolutely. Shaping. Shaping is reinforcing successive approximations of desired behaviors. You use it a lot in FCT. Let's say you want to teach the word bubbles. Okay, you reinforce bu, then you reinforce bub, then you reinforce bubs, and then you reinforce bubbles. Successive approximations until you reach that desired behavior. Always read your answer choices. D, receptive instruction. No, the only answer here is shaping. Okay, again, 16 is extremely easy. 17, easy, but disguised as a more difficult question. Okay, answer the question they're asking, okay, and you're going to be fine. 18, your client will occasionally scream at the top of their lungs. There are no clear antecedents or consequences. Your BCBA is attempting to figure out what the function of the behavior might be. Which of the following would not be the function of this behavior? So what do we know? We know our client screams at the top of their lungs. We don't have clear antecedents. We don't have clear consequences, okay? We have to determine which of the following would not be the function of the behavior, okay? A, could it be attention? It might be, okay? There's not really enough information, but it could be, okay? So A is in play. B, tangible. Again, there's no clear antecedents, no consequences. So perhaps, right? Tangible is a function, so maybe. So kind of unclear between A and B. C, control. What's wrong with control? Well, control is not one of the 4 functions. It's kind of a trick question, right? Sensory automatic is one of the functions. So since we don't know much about it, we don't know antecedents or consequences, okay? The only one we can eliminate right now is control because it's not a function of a behavior. A question like this is super easy if you are fluent in your terms and definitions. If not, and you're not familiar with the 4 functions, this question becomes a guessing game. Simple as that, okay? Because there's not enough information to actually figure out the function, right? All we know is what isn't a function. And what isn't a function is control. So important to know your terms and definitions. The test becomes so much easier. 19, RBTs are required to receive monthly supervision from a supervisor that is an approved provider of supervision. If you work 100 hours in April, what is the minimum amount of supervision hours you would need to meet requirements? So they want you to know what does it take to maintain good standing as an RBT. And part of that is receiving supervision on a monthly basis. The question here is how much? How much supervision do you need? Do you know that answer? Okay, you have to for the test, right? RBTs need 5% supervision of behavior analytic services in a month. So this question, you worked 100 hours in April, you need 5%, okay? What is the minimum amount of supervision you would need to meet requirements? Simple math, right? Is it 1 hour, 5 hours, 10 hours, or 20 hours? Simple math says 5% of 100 is 5 hours. The answer here is B. Don't panic about math questions. You have a calculator, you have scratch paper, and the math questions are easy enough to do in your head, okay? This is not so much a math question either. It's asking you, do you know how much supervision you need? Do you know your requirements as an RBT? Because it's on the task list and you need to know it, okay? So 19, you need 5% of hours, 5% of hours supervised, 100 hours in April, minimum amount is 5 hours. Finally, 20. In which of the following scenarios would duration be the most appropriate measurement? So we've got 4 scenarios. The question is asking us, when will we use duration? What's the most appropriate time to use duration? Let's look at A. Your client has an eating disorder. You want to track the length of time in between meals to determine how often they're eating. Ooh, okay, be careful here. Duration is a measurement of time. Our answer choice says the length of time, but what are we measuring? Are we measuring the length of one behavior? Or are we measuring 2 behaviors, right? The time in between 2 behaviors. Well, we're measuring the time in between 2 behaviors. And what do we know the time in between 2 behaviors is? It's inter-response time, right? A is out. Be very careful, okay? Don't just read the words and jump at it because it says time. Understand what the answer choice is saying. Understand what the question is asking. A is tricky. B, you're driving to the beach. You make a bet with your friend that your route is faster than theirs. It's pretty good, right? You're taking one route, they're taking another. You're going to time yourselves. Who's faster? Seems like a pretty good time to use duration, right? We're measuring the length of one behavior, which is your trip, and you're just going to compare it to their duration, who's longer. B is very good. It's very strong, but we always need to read all of our answer choices. Make sure. C, a teacher is tracking the number of attempts it takes for each group to solve 10 math problems correctly. Immediately, you should eliminate this. Why? Number of attempts is counting, okay? So doesn't matter the rest of it. It's not duration, okay? It's not measuring a time. C is out. That's how quickly you can eliminate these, okay, if you're familiar. And then D, your client's mom wants to reduce the amount of time it takes for your client to respond after she calls their name. Again, careful. Don't just read amount of time and think, oh, duration. What kind of time are we tracking here? You know, what are we, not to get technical, but what are we really looking at here, right? We're looking at the time it takes for the client to respond after she calls their name. So time from the SD, calling their name, to the response is what? Latency. D is measuring latency. Be very careful, okay? Don't just look at the words. Understand what the answer choice is saying. How does it relate to the question? And then give your answer. The best answer is B, you're driving to the beach. You bet a friend your route is faster than theirs, and you time your routes. B is the answer. All right. Hope you enjoyed that. Okay. More videos coming this week. As always, please leave comments and questions below. Happy to help. If you're looking for our study materials, okay, check out our website. All right. We have 2 practice exams up there that are different than this one. Okay. We have a full RBT task list study guide, our combo pack with everything and flashcards, our best deal, and then our competency study guide for the initial and the reassessment. So continue working hard, continue studying hard, and I will see you soon.